Morphine, a lifesaver or a life spender? Well, morphine is a morphine alkaloid that is a highly potent opiate analgesic psychoactive drug. Morphine acts directly in the central nervous system to relieve pain but has a high potential for addiction, with tolerance in both physical and psychological dependence developing rapidly. So morphine is the most abundant opiate found in Papaver somniferum, and it is an organic heteropentacylic compound, a tertiary amino compound, and a morphine alkaloid. So, to back up the formulated hypothesis of scientists and other people, a lot of researches regarding the effects of morphine was published. All of these researches were proving something about the usage of morphine and what should we need to know about this drug. Even before, it was already a rampant issue if morphine really benefits life or not. Even if there are science studies that provides evidence for the good effects of morphine, majority of the studies proves how morphine affects lives badly.
Morphine administration can have adverse side effects. Morphine is analgesic administered to give aid to any moderate or chronic pain. Yet, in contrary to its benefit, morphine can also have adverse side effects. Short-term use of morphine can cause drowsiness and nausea. Extended use of morphine can cause life-threatening side effects. One of the examples of its adverse side effect is that it can increase the progression of tumor among breast cancer patients. Result from the study of Vimonte et al. 2015 says that morphine increases tumor angiogenesis and accelerate the progression of breast cancer. Morphine can also promote cancer cell proliferation, invasion, and metastasis. Another example is about stem cell tissue repair. Accumulating evidence suggests that stem cells can accelerate the tissue regeneration through various mechanisms. But according to the findings of Holland et al. 2018, morphine can decrease tissue healing of stem cells and can affect to its function.
Scientific research shows that despite numerous social, psychological, and medical projects aimed at reducing the phenomenon of substance abuse, the number of individuals with opioid use disorder is steadily increasing worldwide. Substance use disorder develop as a result of long-term administration of substances, including morphines, that will lead to physical dependence and psychological addiction. Physical dependence is associated with the neuroadaptive changes in the central nervous system. This is all about the withdrawal symptoms of a person can experience if he or she will going to take morphine. Psychological dependence is defined as compulsive drug use to improve perception of well-being. A typical syndrome of psychological addiction are intensified drug-seeking behavior and compulsive drug intake despite awareness of its harmful effects.
Opioids' permanent harmful impacts are caused by a variety of mechanisms: the action of the medication on the hypophysis or the hypothalamus, the direct effect of the drugs in the seminiferous tubules, or a combination of both may cause these changes. And this mechanism has brought us into an idea that negative impacts of morphine won't vanish the minute a person halted taking it. And this idea is being supported by the two articles that stated that adverse effects of morphine and K molecules involved in fertility-related pathways on male rat. It shows up that morphine may diminish the reproductive parameters in this animal model of addiction. And since medicines alter physical parameters as well as mental and physical dependence, with changes that can last even after the drugs are stopped, medications can impact the genitourinary system, and because of its relevance in the survival of the human race, research into the effects of drugs on this system is critical. And this idea has brought us into a conclusion that morphine use can impact the genitourinary system and can cause infertility, even after the time the individual's exposure.
Series of adverse effects. At first glance, we may think that there is nothing necessarily wrong with taking morphine. And in fact, morphine has been used for many years to relieve cancer pain. Sometimes we may argue that negative feedback of morphine is all due to the fear of the patient and family members and the misinformation and lack of training. This argument sounds compelling that despite a terrible problem of narcotic addiction, a world without morphine would have more suffering, not less. Without morphine, untold numbers of people would have spent their lives in great pain, Trevor Stone added. However, even controlled use of morphine cannot resist addiction because morphine dependence can develop even when taken on perception. The drug's potent euphoric effect makes addiction possible after only a few doses. Moreover, chronic use of opioids can cause changes in the sexual traits and sexual hormones, Amalia H. et al. Added, and came up with the findings that morphine use can impact the genitourinary system and can cause infertility. Conversely, morphine is a medication that is used to treat moderate to severe pain. However, it can have negative side effects. According to certain studies, morphine has far more effects than just analgesic. The evidence of decreased tissue healing following morphine administration or in opioid addicts suggests that morphine may harm stem cells and their function. The findings of this investigation show that morphine can accelerate the growth of breast cancer cells while decreasing stem cell repair and tissue regeneration, confirming that morphine has truly negative side effects. So if you think that you can manage morphine, please think twice.
So what is really the course of this study is the usage of morphine can bring more advantages or disadvantages in the holistic well-being of a person. As stated from the introduction, throughout the other bodies of this study define what it is and what its purpose. After weighing out the advantages and disadvantages, we've come to conclude that this morphine drug is indeed will bring more disadvantages and negative effects rather than positive effects in the human body. In the psychological and mental well-being aspect of the person, the usage of morphine can cause and lead to a addiction. Other than that, in the aspect of reproduction of the human race can be affected a lot for the reason that the usage of this drug can alter sexual traits and sexual hormones. Third, in the field of health, battling with cancer is tough, one where there is fact in this very second a large number of people are still search for the help and aid for this illness. The usage of this drug rather than to aid illness is just to make things worse by multiplying cancer cells. Life is greater wealth than all the riches. Therefore, life we have today is treasure. The life of people must be protected and saved. Thank you.